Well, in Idaho, we now know when more people may start to get vaccinated. Today, leaders outlined the rest of the state's plan for its vaccine rollout. Ian Smay of our Creme 2 vaccine team is in the newsroom tonight to explain what it all means. Ian.
Yeah, Regina, the news comes after Governor Brad Little approved recommendations from the state's COVID-19 Vaccine Advisory Committee. New groups of people will be eligible every few weeks going forward if all goes to plan. But the biggest headline is that we now know when the general public is supposed to be eligible for the vaccine. The recommendation approved by Governor Brad Little means that Group 3 is no longer based on occupation. Instead, it will now be based on age and pre-existing medical conditions. On Monday, Idahoans aged 55 to 64 with at least one underlying condition started to be eligible and were given priority for 1 week. Next week, all Idahoans 55 to 64 that are part of the general public are eligible. After this 2-week period, the eligibility opens up for those aged 45 to 54 on March 29th, with the first week of the 2-week period being for those with underlying health conditions. That means that on April 12th, the eligibility opens up to those aged 16 to 44 with at least one pre-existing condition. Then, 2 weeks later on April 26th, all Idahoans 16 and up become eligible.
So this means that before May 1st, all Idahoans will be eligible for vaccines. We are very excited about this opportunity and this schedule.
Like Elke Shaw-Tolek said, this plan means that Idaho will actually beat the guidance given by President Joe Biden for states to make the general public eligible by May 1st. If a 16 or 17-year-old wants to get the vaccine but their parents don't want them to, the state says a discussion will happen with the parent and the provider. Some providers in the state have also started making no-waste waiting lists to make sure unused doses don't get wasted. In the newsroom, Ian Smay, Creme 2 News.